In this video, I'm going to go through my top 7 chiropractic myths that I've encountered to hopefully show you the truth about these myths. Let's begin. So myth number 1, if there's no crack, there's no effect. This is false. Now, I can explain this by simply showing you what happens when we adjust the spine and why you hear a click on some of these adjustments. So when we adjust the spine, what we're doing is we're looking for specific segments that have lost their motion, so they're restricted. Quite often it's a painful area because there's inflammation in the area, and there's typically also a misalignment, which we can usually see on an X-ray. So what we're doing when we're correcting this dysfunction is by applying a specific adjustment into that joint as a quick motion. As we make that adjustment, we're giving the surrounding ligaments, the joint capsule, the muscles, a very quick stretch to change the resting position of that joint. Now, the reason why you sometimes hear a click with an adjustment is because there is a pop of a bubble within that joint. As we make that adjustment, there's a distraction force that happens within that joint, in the joint capsules, which forms little bubbles, and then they get popped as the joint gets moved even further. This pop is not really where we get the effect. The effect mainly is going to occur at the level of the brain, with the stretch receptors in the area activating certain areas of the brain, which are going to then change the position of that vertebra and also get some more motion in there. And this is what the body wants. This is particularly what the spine needs. The body loves motion. So some of the techniques that we use to adjust patients are aimed to get a click because we want to get a certain degree of motion and we want to get a certain effect. But some of the adjustments we use, particularly if it involves a drop piece, so the portion of the bench that you're resting on will just drop away slightly, that will increase the effect. The effect we're going for when we perform these type of adjustments is to make a change at the level of the joint as well as the brain. So just because you don't hear a click doesn't necessarily mean there hasn't been an effect. Number 2, chiropractors only deal with the spine. This is false. We center ourselves on the spine because the spine forms the centrality of the body mechanically. So anything that you do is going to involve the spine mechanically, but also because it houses the central nervous system, more specifically the spinal cord, which innervates and controls almost every part of the body by the nerves that come out of the spinal cord. So this is why we're going to center on the spine, because this is the area that we can get the most amount of effect on the body, and this is typically the area where a lot of the issues in the body will stem from. But we're also trained to treat any muscle or joint within the body, so this can include the hips, the knees, the ankles, the feet, the shoulders, the elbows, wrists, and the hands. Effectively, we are dealing with the neuromusculoskeletal system, i.e. the nervous system, the musculoskeletal system, which is going to be your muscles and your joints and your bones. Myth number 3 is chiropractic is non-scientific, or as Wikipedia calls it, pseudo-scientific. This is very much false. Particularly in the last 20 years, there's been a huge amount of research that's gone into the effect of chiropractic and the chiropractic adjustment. And we've seen lots and lots of research, particularly by Heidi Harvick, in terms of the changes that we see in the brain when we apply an adjustment. There's been some research by Heidi Harvick that has shown without a doubt that we get a 20% change in the prefrontal cortex in the brain by simply adjusting the spine. There's lots of other research to show how it has a huge amount of effects, particularly for back pain, low back pain, and neck pain. So these are the areas that we have a lot of research in. Granted, there is a lot of research that we still need to do. Chiropractic is very scientific. Myth number 4, all chiropractors are the same. Now, I wish this one was true. Chiropractic stemmed from the United States in 1895 by a guy called D.D. Palmer, who developed the chiropractic profession, and essentially from that point it stemmed outwards to many different streams. So there are tons and tons of different techniques within chiropractic, which is one of the reasons why we get different ways of treating people. So you can go to two chiropractors and be treated differently because of the techniques they use, but also because there's different philosophies within chiropractic, different things that people believe about what we can do for the body. We are, however, all underneath the General Chiropractic Council, which is a registration that we must all have to be able to call ourselves chiropractors, because chiropractic is protected within the UK. So this, of course, is going to give us a good level of continuity between each person, but there is also a good amount of differences. Number 5, chiropractors aren't real doctors. Now this very much depends on your definition of a doctor. If we go by the definition by the Collins Dictionary, it is defined as a person who is qualified to treat people who are ill. And this is exactly what we do as chiropractors. We're not treating people who have systemic diseases such as heart disease or cancer, but we are treating people that have chronic or acute issues with the spine that can be very debilitating. We are also not medical doctors giving out drugs that GPs might give out, and we're also not PhD doctors, but we are doctors of chiropractic. Myth number 6, you must be referred to a chiropractor from a GP. This is false, although you can be referred from anybody, including a GP. We have the thorough training to be able to diagnose not just the things we can treat, but also recognize the things that we may need to refer almost to a hospital or GP that we cannot treat. So we have a very in-depth and safe knowledge in terms of the diagnosis, and so we're always looking to see, can we treat this person and get some good results? And if we can't, we're not just going to go ahead anyway and hope for the best. We will refer you to that best person. So you can come to a chiropractor directly and at least have the consultation, and we can see what's going on. And finally, myth number 7, adjustments are painful. This is very rarely true. We are, of course, making changes to the body, and sometimes that can produce a little bit of inflammation within the joint when it's been adjusted, but usually that's going to be a little bit of discomfort afterwards in less than 50% of people that we see, and this very much depends on what kind of technique the chiropractor uses. Very unusual to see adverse reactions, and it's very rare for the adjustment itself to actually be very painful. So I hope this video has been useful. Please do put in the comments any other myths that you come across that you want me to answer, and I can answer them below. Like the video if you've seen some good value from it, and subscribe for new videos every single week. See you next time.